Illinois is months away from the launch of a new suicide prevention hotline, and state lawmakers are working to make sure it gets funding. Under federal law, the new 988 hotline takes effect in July. The state Senate this month passed a bill creating a statewide 988 trust fund aimed at setting up and running a mental health crisis prevention and response team around Illinois. That bill is now in the State House. And joining us to talk about the hotline and what work still remains are State Senator Laura Fine, the bill's chief sponsor, and Alexa James, CEO of NAMI Chicago, part of the National Alliance on Mental Illness. Welcome both of you back to Chicago tonight. Senator Fine, I'll start with you. The federal government launched the 988 hotline, much like 911 for emergencies. So how will this hotline work in Illinois once it's up and running?
Well, we're still working out everything. This is a tremendous undertaking, but the goal is the positive results that will come of it. And 988 will be 911 for mental health. And so if you are in a mental health crisis, instead of dialing 911, you will dial 988. And the person on the other end of the phone will decipher, do we need to send somebody out? Can we provide you with the help you need over the phone, or what type of services you need. So the goal really is to de-escalate and make sure people get the services that they need and the care they need, and not put a mental health issue or a mental health crisis in the hands of law enforcement when we need it to be in the hands of mental health providers.
And Alexa James, as we mentioned, 988 is a national effort. So will there be local responders when Illinoisans dial 988?
Yeah, I mean, it's definitely something that we're really interested in celebrating and making sure happens. I think what we have to be really clear about is this 3-digit code that is this national code, a tremendous and exciting opportunity, is a front door to mental health care. We need to make sure that on the other side of that door, there is comprehensive services. We do not want to disappoint callers who are sticking their neck out bravely, asking for help, or teenagers who are texting for support. We want to make sure that we have an infrastructure involved. And if we do, we have to make sure that on that other side of the door, that we have appropriately resourced and invested in resources that we currently are still building, that we don't have. Part of the to your regional question, Paris, is part of our push to make sure that these call centers are hyper-local and hyper-regional is exactly to your point. Because if you're calling in crisis in Champaign, or if you're calling in crisis from Chicago and you're answered in Champaign, they don't necessarily understand the intricacies of the pilot mental health dispatch that we're doing in Chicago, or our CARES team, et cetera. So it's super important that there's some fluency and that we have adequate mobile crisis response, 24-hour living rooms, adequacies in terms of people if they do have to go and do an in-home intervention, that we have all of that stuff available to folks.
And Senator Fine, Governor Pritzker in his budget proposal allocated $70 million toward crisis response services for folks that do dial 988, $5 million specifically into the fund that your bill creates. Why is this funding important?
Well, this funding is essential because we need to be able to get 988 off the ground in a successful manner. And you can't do anything without funding these projects. We have to make sure that we are able to hire the people to work the lines and make sure that we have the services in place. And all of this takes funding. And in Illinois right now, I'm just proud to say that we are making the investment in this life-saving phone number that's going to impact so many families.
And Alexa James, you talked about some of the challenges of making sure there are local responders. The hotline's set to go online in July. What are some of the other hurdles that this faces before it gets up and running?
Well, I think it's transformative, and fortunately, this is a project in which we get to lean on our neighboring states, because everyone's building this right now, and it, like Senator Fine said, it's a huge lift. I mean, what we have to get through too is Medicaid reform, so that agencies who are providing this mental health support actually have adequate resources to do so. We have to make sure that there's real longevity and connection, and that these aren't transactional calls. Just when somebody is in crisis, it doesn't mean that there needs to be a stop. There needs to be a stop of the cycle of crisis. And so do we have long-term support to link them back to in communities like a therapist, stable housing, et cetera? So I think that that's really important for us. We certainly learned that on NAMI's helpline, the importance of not being transactional, but really being that supportive ear and listening to people and then following up and being able to connect. I think that the rapport building too is going to be exceptionally important, because this is just like we say to 911 call takers, you're the first line of de-escalation in a crisis. These clinicians who are going to be manning the phones are the first, sometimes trust building for folks in the mental health system that have not felt trust in the mental health system before.
Certainly there's going to be a lot of responsibility then for some of those folks on the other end of that line. Senator Fine, in addition to this, you're working on a mental health omnibus bill that deals with a number of things. Give us the bullet points of what's in this bill.
Absolutely.
And I should mention we're looking at some of those right now, but go ahead.
Okay, and I'm not quite sure what you're looking at, but I'll give you my nutshell. I was very proud that this bill passed with bipartisan support unanimously off the floor today. And this is something that we've been looking at and started working on over the summer. And we started working with our mental health providers. And what we found is we have a workforce shortage. A very sad issue came up when we had a subject matter hearing this summer. And this was one of our they had 27 open beds, but they also had a waiting list. And the problem is they can't fill those beds because they don't have the staff to work those beds. And we have to make sure when patients go inpatient that it is a safe and supportive environment. So this bill will hopefully take care of a lot of the issues we're seeing right now. It looks at licensing people, and it cuts the red tape if you are licensed out of state and you want to practice in Illinois. It also streamlines the process if you have been out of the workforce for a number of years and you want to get back into the mental health workforce. It sets up a task force so we can look at what's going on in minority communities and how we can get more minorities and people of color to work in the mental health field, because people feel more comfortable if they can talk to somebody who they feel like has a shared experience. So this bill covers a wide array of issues that we are really hoping will help boost the mental health workforce.
A lot of things in there past your chamber. We'll see what happens in the House. And our thanks to Alexa James and State Senator Laura Fine. Thank you all so much.
Thank you.
Thank you.